Bismillahirrahmanirrahim. I'm Fawad, Assistant Professor, Department of Pharmacy, University of Science and Technology. Welcome to the course Pharmacology and Therapeutic. Today we will discuss about anti-amoebic drugs. Outlines. We will discuss the following outlines, the following contents one by one, like anti-amoebic drugs, nitroimidazole group containing metronidazole as its prototype drug. So the metronidazole chemistry, metronidazole mechanism of action, metronidazole spectrum, metronidazole pharmacokinetics, metronidazole uses, metronidazole adverse effects, and its drug interaction. Lecture outcomes. After watching and listening, this student will know about what is amoebiasis, metronidazole mode of action, clinical uses based upon its spectrum, and unwanted adverse effects and its interaction. Amoebiasis. It is an intestinal infection basically caused by the protozoan. It is an intestinal infection caused by the protozoan. So by specifically by Entamoeba histolytica. Normally it lives as commensals under unknown stimulus. It invade mucosa and causing amoebic colitis. In larger gut, organism found as a cyst or as a tropocyte. They are present in the cyst form and in the tropocyte form in the large gut. Vegetarian form replicate, maintain infection. Maintain infection. Like for example, this is the diagrammatic pathogenesis of how amoebiasis, pathogenesis of amoebiasis. For example, this is the like if the patient ingests the cyst, ingestion of the cyst, it move into the intestine, like move the cyst move into the ileum, and in ileum there is formation of tropocyte, and these tropocyte, these are basically the cyst, and from these cyst there is the formation of tropocyte. Then tropocyte move like forward, containing they further converted into cyst and remove excreted out through rectum. But this this tropocyte also invade, penetrate the intestinal wall. They penetrate into the intestinal wall, and there it causes multiplication of the tropocyte within the colon wall. Like these tropocytes formed from the cyst enter into the intestinal wall, multiplication of tropocyte within the colon wall, and then they invade into the system. There is a systemic invasion into the liver. Okay, so these tropocytes are like excreted through rectum, or converted into the cyst and then excreted, or they invade, penetrate into the small intestine, penetrate into the intestinal wall, where the multiplication of the trophocyte occur within the colon wall. Then there is a systemic invasion into the liver. Okay, so the uh, expelled cyst is further converted into expelled, cis-infective, and non-infective. The non-infective is basically tropocyte. Tropocyte does not causes any harm or further transmission to another to others. So the basically expelled cyst is an infected and causing the infection. Okay. So cyst discarded with the feces. Okay. Let's see. There are some drugs, like there are the drugs which act with the different phases to reduce this type of infection is like formation of trophocytes from the cyst into are controlled by the luminocidal amoebicide like dioxazonide furoate and paromycin iodopinol. They block the conversion of cyst into the trophocyte and further into the, like for example, if the trophocytes are blocked, normally cysts are excreted into the in the feces, and they do not invade they do not have any invasion into the systemic circulation, and like in the liver. Okay. Second one is the systemic amoebicide block the systemic invasion. For example, chloroquine and dihydroamidine and amidine block the multiplicated trophocyte into the liver. The third class drugs, anti-amoebic drug, is the mixed amoebicidal luminal and systemic. They both have luminal and systemic activity. Okay. Transmission. So they have transmitted in the cyst form, like we discussed earlier in the pathophysiology of the amoebiasis. Is like the cyst is the main causative and infective agent. They are transmitted through fecal oral route, like flies, fingers, foods, fomites, etc. Hematological spread from the colon, like liver, lung, brain. These are the hematological spread from the colon. Distribution of amoebiasis, like cosmopolitan but more tropical and subtropical. Predisposing factor of amoebiasis, like if there is a poor hygienic condition, chances of contaminated food increases the risk factor of amoebiasis. Lower socioeconomic group, institutions, mental hospitals, hotel hostels where there is not proper, where there is not proper management or hygiene or sanitation, etc. Male homosexuals, deficiency of immune system or immunosuppressant, like patient on the chemotherapeutic agents or organ transplanted patients, or patient with immunosuppressive agents, like having the autoimmune diseases. Asymptomatic, it's a carrier state. There are types of amoebiasis. Asymptomatic carrier state. There is mild to moderate symptomatic colonic infection. And third one is severe intestinal infection like dysentery, acute or chronic. Extra-intestinal infection like amoeba, hepatitis, or abscess. These are the types of the different amoebiasis, like asymptomatic, mild to moderate one, symptomatic, colonic, mild to moderate, severe, and extra-intestinal infection. Diagnosis: like they can be easily examined by examining the stool, rectal scraping. So treatment: preventive measures like precautionary measures, improve non-pharmacological measurement precautions like improve hygienic conditions, so improve the status, etc. And then the second one is the drugs. Anti-amoebic drugs. There are, like first we are discussing the pathophysiology, like how amoebiasis are caused. We discussed there are three different classes of the amoebiasis: luminal, systemic, and mixed. So luminal amoebicidal, there is dichloroacetonamide, dioxazonide, clefamide, etofamide, teclosan, and halogenated 8-hydroxyquinolines like idoquinol, quinoquinol. Antibiotics like tetracyclines are effective. They have antiprotozoal action. So paramomycin, erythromycin, systemic or tissue amoebicidal agents. They block the invasion of the multiplicated trophocyte from the colon wall into the liver. So an epic one alkaloid, and that's like emetine, dihydroemetine, emetine bismuth iodide, 4-amino quinoline, like chloroquine, mixed. They are mixed aminobutyric. They have both luminocidal action and systemic aminobutyric action. Like for example, nitramidazole. They have derivative like metronidazole, tenidazole, ornidazole, secnidazole, nimrazole. So nitramidazole. So like there are three different type of classes: systemic, luminal, and mixed aminobutyric agents. Starting from the mixed aminobutyric agent like nitramidazole derivative, specifically we discuss here in the prototype drug, which is metronidazole. Chemistry. Nitramidazole compounds. This is a nitramidazole compound. So these are other metronidazole, idaquinol, and other aminobutyric agents. They are different structure. This is the structure of nitramidazole derivative. Mechanism of action. They are selective toxic to the anaerobic microorganism. Micro aerophilic microorganism, anoxic or hypoxic cell. Within all above cell nitro group is reduced by, like in this, in all these all micro the like organisms within above cells, in these cells the nitro group of the metronidazole is reduced by accepting the electron from the electron transport proteins such as flavoprotein in mammalian cell and pyridoxine in other, in or they're relevant in the bacteria. So they accept electron from the electron transport protein. Chemically reactive reduced form formation of cytotoxic product like superoxide anions, hydroxyl ions. They are chemically reacted form formation of cytotoxic products. They causes loss of helical structure of the DNA, strand breakage, impairment of function of the DNA. So potentiate the effect of radiation on hypoxic tumor cells. So this is the mechanism of action. Like the nitro group is reduced by accepting electron from electron transport chain. They produce cytotoxic products like superoxide anions and hydroxyl, which ultimately causes the loss of helical strands of the DNA, strand breakage, and impairment the function of the DNA, resulting in the cell death. Spectrum. Trophocyte of they are effective against the trophocyte of the Entamoeba histolytica, Giardia lambia, Balantidium coli, Blastocytosis hominis, Trichomonas vaginalis, anaerobic bacteria. They're important because, like we see in the most of the dental preparation, flagell, metronazoles are prescribed because they are effective against the anaerobic bacteria, which is present in abundant. which is present in the buccal cavity. So micro aerophilic organism, some aerobic organism in mixed infection, radiosensitizing effect on hypotoxic tumor cells. So available for the oral tablet suspension, IV infusions, well absorbed orally. 500 milligram give peak concentration of 10 microgram per ml. So they have minimum protein binding. Being a molecule penetrate all the tissues. Intracellular concentration is equal to the extracellular concentration. So T half is equal to 7.5 R. Metabolize in the liver by the microsomal uh, system, excreted in kidney by an active metabolite. So these are the like they're present in different like oral, IV, in different form. Okay, they are effective in amoebiasis, like in most or more to moderate intestinal severe infection. They are most effective. They are effective in hepatic amoeba, like extra hepatic infection discussed in hepatic and amoeba or excesses. Along with the luminal amoebocytes, they are effective yeah, in amoebiasis. Urethrogeneral trichomoniasis, like they are effective, for example, 250 milligram 3 times a day for 7 days. And they are also effective in JDSs, like 250 milligram 3 times a day for 5 days, and Balantadiasis. Giardia vaginalis, if tetracycline, they are also effective in the Giardia vaginalis if tetracycline is inefficient, anaerobic infection, sepsis, specifically in dental preparation, the dental infection they are most commonly used. They also use against again the acute ulcerative gingivitis, pseudomembranous colitis, and Cancrorum oris, decubititis ulcer, pancreatic leg ulcers, other intolerant regions, colonic Crohn's disease, which is an inflammatory bowel disease. Adverse effect. Most commonly, it's also effective in the food poisoning caused by the like food poisoning. The infusion of the metronidazole is indicated. One of the like the mild to the adverse effect. Okay, so mild adverse effect. One of the main or the promising or noticeable adverse effect of the metronidazole is the metallic taste. There is the appearance of metallic taste. If you use them, if a patient administer infusion, they can easily like they know about they feel the metallic taste or the tablets for the patient is using 2 to 3 days 2 3 days of flygel. There is a taste appearance of taste, the metallic taste, nausea, epigastric distress, stomatitis, abdominal discomfort, diarrhea, burning sensation in urethra, vulva and vagina, vertigo, headache, paresthesia. Rare and severe, serious, like there is a serious seizures, ataxia, encephalopathy. There is pseudomembranous colitis, moniliasis, candidiasis, leukopenia, mutagenicity, and carcinogen. These are present, but they are rare. They are teratogenic, so contraindicated in the first trimester in the pregnancy. Thrombophlebitis, IV administered. They have disulfiram-like reaction. So they have interaction like potentiate the anticoagulant effect of fumarine groups like alcohol, liver, diseases accumulated. They are enzyme inducers, so they have interaction with the enzyme inducers. Thank you so much. reference